I get the same feeling with cardiology that I think Churchill had waiting for the Americans to join in the Second World War. So you can rely on them to do exactly the right thing once they've explored all other options. We've known for a long time, 2003, that the best treatment is PCI, opening up that artery, re-establishing the blood flow. Countries like Italy, talking strategically, 30 years ago had third world healthcare, redesigned their whole healthcare system around delivery of this treatment and became third best in the world, better than us. Okay, if Italy can be better than us, we need to examine ourselves and what we're doing. So here we have the disease that disables and kills the majority of us. Heart and stroke is still the biggest cause of death and disability in North America and in most of the developed world. We don't get the first choice treatment, which is the balloon and the stent. The second choice treatment would be drip and ship, which is start the clot buster and get them across to where they can get the definitive best treatment. And I don't know why we don't have that as an automatic second option, because that's also in the guidelines. Instead, we have this delay where we wait to see if it works, and then we try to organize this overburdened transport system and get them into a place that's already packed and where there's resistance. And I can't tell you how often I've had the answer on the phone when the Malahat's closed or the rotor wing can't fly. Well, you chose to live up there. Well, you'll pay the same taxes, and there's very little standing in the way of them putting that facility here so the majority of people on the island can access that best care. So strategically, we have put all our eggs in one basket. You can go to the website of the Capital District and they will tell you that their experts have informed them that there is a 32% chance of 9 on the Richter scale quake in the next 50 years. So everyone right now who's having this problem, never mind when the earthquake comes, has to go through the bottleneck of the Malahat, which according to Ministry of Transport, average closure at least 1 day a month. How many times we can't fly? More often than that, and sometimes flying is the time span you need quicker than going by road. So we have chosen to put everything the furthest away from everybody on the island. There's a total lack of strategic thinking. There are other things, never mind earthquakes. There are resistant superbugs. If they get an infestation of Candida aura in Victoria, they will close their cath lab for 3 to 5 days. Are we all going to go to Vancouver? Are they all going to go as well? Why don't we have a second option for earthquakes, for bugs? I would have thought COVID taught them this as well. If we get another epidemic or something and their staff will go down with it, do we want to have only one option for the island? I don't understand why we don't do this. Then there's just the operational side of things, talking about sole sourcing. We have a 6 to 24 week wait for semi-urgent cardiac caths. So the North Island got 1,800 of the cardiac caths last year, and the South Island got 1,400 of them. So the majority actually come from up here, whether it's acute or chronic. But that chronic waiting list is between 6 and 24 weeks for what is classified as semi-urgent. This is stuff that should be happening in 24 to 48 hours. So there's a total, I think, lack of strategic thinking. If they open a cath lab here, we could empty that parking garage that was referred to earlier. We could clear a whole lot of beds. We could shorten that wait list. The cath labs are so backed up for this life-saving stuff, opening up your coronaries, that other things like replacing aortic valves have a 2-year wait list, what they call TAVIs. Now, the funny thing is that a lot of people, a lot of people on that wait list have 1 year left to live if we don't replace their valve, but the wait list's 2 years. Strategic thinking and the lack of it again. So I think we need a cath lab here pretty urgently so that everyone gets the best treatment.